Welcome to the Stress-Free Dentist podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches, or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD.
All right, everyone, welcome back to another episode. And today we are joined by Dr. Chad Duplantis. Chad, thanks so much for joining us.
Eric, thanks for having me. I really appreciate it and love being here and love what you're doing for dentistry.
Yeah, and where are you zooming out of today?
Fort Worth, Texas, where the West began.
Where it all began. Is that where you began? Is that where you're from?
I am. No, I'm originally from New Orleans, and then I spent half of my childhood schooling years in Houston, half in the Dallas area, and then it's very different. Like Dallas and Fort Worth are right there together, but you either choose one or the other, and I decided to gravitate towards Fort Worth. It's a little bit more fitting to me. So that's how I ended up here.
And what about becoming a dentist? How did you decide to become a dentist?
Really, really a funny story. When I was in high school, I thought that I wanted to be a physician. I really thought that I wanted to be a psychiatrist. And then I realized very quickly that in order to be a psychiatrist, that I kind of needed to be a little bit crazy myself. And I decided that wasn't the path I wanted to go down. And I didn't want to go to medical school residency and spend, that much time in school. And I worked for this dentist just oddly in high school. And it took me a couple of days. I worked for an amazing female dentist in Plano, Texas, Dr. Becky Matthews. And it just after a couple of days, I realized, okay, this is for me. This is exactly what I want to do. I had always enjoyed going to the dentist. I liked her work schedule. I liked how she was able to relate to her patients. I liked the type of work that she did. And, everybody seems to say this, but I loved being able to be an artist of sorts, if you will, through what we create for people's mouths. And it just went from there. It's been amazing. And I still consider her one of my biggest role models in dentistry.
So we have a couple of things in common. I went to Tulane, so I'm very familiar with New Orleans. Yeah. And I graduated with a psychology degree. And I also thought about becoming a psychiatrist. And you're so right about, you got to be a little crazy to be a psychiatrist. And, but if it wasn't for a beer bottle to my front tooth, and me wanting, getting a great experience in Metairie, Louisiana with the local dentist there, I probably would have done something else. But it sounds like you had a great mentor as that, working for that dentist, and that's what wanted you to go to dental school. Do you think having a mentor is extremely important?
Yeah, I really do. I mean, I'll just go ahead and rip the Band-Aid off. Dentistry is a tough profession. I mean, it's rewarding, but it's grinding. I mean, we're doctors. We're also business people. We have to manage a lot of people. We have to make sure that we abide by certain guidelines, rules, regulations, and so on and so forth. And then we have to practice quality dentistry as well. And sometimes we need people to help us through that. We need people to model ourselves after, to model our practices after. It doesn't mean that you have to do everything the exact same way, but you can have several mentors. and choose a little bit of how somebody does it versus how somebody else does it. And in addition to that, your mentors don't even have to be dentists. They just have to be good role models for the type of person, professional that you want to be.
And now, who would you consider your mentors right now?
I have several. I've always looked up to Dr. Matthews. She's now Dr. Cloetta. She just really practiced such a great family style practice. Absolutely loved it. A lot of people will have taken several courses, which I'm sure we'll talk about in a few minutes, but Dr. Stephen Cutbirth out of Waco, Texas, practices dentistry the way that I always wanted to practice dentistry. He taught me a lot. He has an aesthetic and master's curriculum continuum, if you will, in Dallas, Texas. Learned a ton from him. But outside of clinical dentistry, I do a lot of speaking and teaching. And my most profound mentor in that arena is not even a dentist. He's a product representative or manufacturer rep. He's been in sales his entire career, but he works very closely with KOLs. And he taught me pretty much everything that I needed to know about speaking and communicating effectively in front of people. So those would probably be my top three. And then, of course, materials. One of my mentors just passed away, Dr. John Burgess. Dr. Chuck Wakefield was my residency director, and he is so knowledgeable on materials. I mean, the list goes on, but there's just different people for different facets of my career that have helped me along the way that I know I could call on at any point in time.
I always tell young dentists that it's so important to engage with your peers, to find good coaches, consultants, therapists, absolutely, whatever it takes, but also mentors, because you can learn so much from a good mentor. Do you think that young dentists don't get that part of their career ready soon enough in finding mentors?
I think it's kind of a split mix. I think that there's people out there that don't really know that they need it. And it's our job. I was with a dentist 2 weeks ago at the International College of Dentists, and I was like, look, if I can be a mentor to you in any way, I'd be more than happy to. And, it was, so sometimes they just need to be asked, if you can help them. You don't even need to call it a mentor, but just say, can I help you? And offer to be there if there's ever, a need. I think there's a lot of people out there, unfortunately, that think they don't need any help. I think that's the sad part. And I've run into some of those young dentists too. And then you'll notice through social media, as you and I are very active in, that they're the ones that 5-10 years down the road, they're begging for help because they're having trouble and they've never really had to ask for help before and don't know how to. So I think it is something that a young dentist needs to start off with, handpick a few dentists or people within the profession or familiar with the profession that you can lean on and, ask for guidance.
Yeah, I think that a lot of young dentists, they haven't gotten a taste of failure or mistakes. They've gotten excellent grades in school. They've had a path carved out for them. They took the DATs, they got into dental school. And then there's, of course, the 4 years of dental school. And then you get out into the real world and you get a taste of failure, and things don't always go according to plan. And a lot of dentists can beat themselves up and put too much pressure on themselves. And it really helps to reach out to peers and mentors that have been there and done that. You can learn so much.
Absolutely. It's an invaluable person or people to have in your life, to have mentors. It just provides so much for you.
Now, you mentioned teaching. What do you teach in dentistry?
I really like to focus on technology. That's probably my biggest area that I teach on, but I also do a lot with adhesive dentistry and, bonding and cementation. But really just, I guess if you were to sum it all up, as to how you can improve your patient experience by utilizing the technology that we have available to us, and utilizing that technology from clerical to clinical, to there's so many ways to utilize technology within your practice from start to finish, with every single patient. So that's my main focus.
Yeah, you can improve the patient experience, but you can also improve your quality of dentistry and how much you enjoy dentistry. And let me know your experience here, but I really felt like, I was stuck in this hamster wheel of dentistry doing the same old thing. And then I started adding new techniques, new workflows, new technology, and I just love it. I love the technology and I love adding new things, and it re-energizes me. So yes, I absolutely give a patient better experience and I can market my office. But for me, I just enjoy dentistry more.
I'm going to say it makes it easier. And I know that's a pretty vague statement, but it makes going to work more enjoyable. The workflows become more efficient. The quality of the work becomes more predictable and consistent. And, you get it once you start playing with technology's come so far since I started. We were very averse to it, and now we really need to embrace it in order to improve the experience for both our patients, our team, and ourselves. And I truly believe, like you do, it makes you a better clinician.
Yeah, you said workflows become more predictable. That has been one of the biggest game changers for me in just having a workflow for everything I do. It helps put my brain at ease. My brain goes on autopilot when I'm doing a filling or a crown or an implant. Implants, more planning involved because it's a surgery, but I go into every procedure with a game plan and a workflow that I've done over and over and over again. And to me, dentistry has become the easy part. It's the patient communication, the leadership of running an office. But what are your thoughts there on dentists finding workflows that work for them?
Well, let's pause for a second and let's go back to technology, because you kind of open a can of worms and something that, I'm extremely passionate about. But, we start talking about workflows and technology. There's a study that came out by the ADA, or a survey that came out, that now that greater than 50% of practices have intraoral scanners in their office. And the majority of them are using them for restorative or orthodontic workflows. However, what I would say is that if you've got a scanner in your office, take 5 minutes out of every new patient exam and take a full mouth intraoral scan. Take upper, take lower, take a bite. And that will start the ball rolling with the patient realizing what's going on in their mouth. It makes it more relatable when you're sharing that scan, what you're seeing in that scan, everything from stain to decay to their occlusion to their malalignment, to there's so many things that we can see. And that really starts a great diagnostic workflow and a patient engagement workflow that can lead to a restorative workflow. And so, that's one of the things that I wanted to say. People have these scanners and they're trying to use them for certain procedures. But if we start using them in that diagnostic examination, that opens up just so many more doors for case acceptance and for patient engagement, that you will be blown away at how much that will benefit and improve your practice. Yeah, so I don't even remember your question. I just thought that I had to throw that in there.
I don't either, because I'm all over this, and I could talk about this for an hour. But every morning huddle, we pick out, who's going to get that diagnostic scan. For us, it's a little bit easier because we have 3 scanners. But for an office that is just getting a scanner, I really recommend to be strategic about where that scanner goes. And we do it on every new patient, and it's become part of our exam. And it's so much easier to explain dentistry. Dentistry is hard to explain, but when you show the patient a 3D representation of their mouth, they're like blown away, and they'll start pointing things out, like what's that silver filling, or what's that metal margin, or you can show them the lower anterior crowding. There's just so much you can do with that diagnostic scan.
And let's go geek out for a second, because we were both obviously interested in psychology back in the day. There's a study from 1972, and it was basically on the way that patients receive and retain information that's given to them. And so only 10% of the information that was orally presented was retained. So if we just talk to a patient about it, they're going to get 10% of it. Whereas 65% of what is visually presented to the patient, they're going to retain. So furthermore, there's a study from the Spear Institute, not Spear Education, but the Spear Institute, and it had these patients that watched a video in the lobby on cracked teeth. And so if they could see the cracked tooth, they learned about the cracked tooth, greater than 90% of those patients were willing to move forward and discuss financing and payment options and receiving treatment on those cracked teeth. And there were 3 different reasons that they decided to proceed. But it's pretty telling that, visualization imagery is extremely powerful in what we do. And so the more we can share with the patients, the more they're going to get out of it, and the more they're going to be willing to proceed with treatment.
Yeah, I really think it evens the playing field for, let's say a dentist is, maybe they're new, they don't have the verbiage down to really explain treatment yet, or maybe there's a language barrier with the patient. You show them that 3D scan of, that cracked tooth or that leaking amalgam. I mean, it sells itself.
Yeah, it does. And you were right. I loved what you said too, because I just presented this on Friday, and we took a break, and we call the initial patient exam scans, we call those wellness scans. There's no charge for them in our office. And so when we went to break, and then after break, obviously they had no idea what slide was next, but somebody goes, okay, how do we incorporate this into our practice? This is a lot to do. And so the next 3 slides were like, how are we going to handle pushback? Because you're going to do this, and your team's going to be like, whoa, hey, sorry, folks, park's closed. Moose out front should have told you, can't do this today. And then all of a sudden you're like, no, that's not how I want you to do it. I don't expect you to throw this to 18 new hygiene patients tomorrow. I expect you to take that schedule and say, hey, Susie, you've got a little bit of extra time on Mrs. Jones. I'd like you to try and scan just Mrs. Jones today. And then pick another hygienist. I want you to try and scan, Mr. Brown. All right. So we got Mrs. Jones and Mr. Brown. Let that go for a week or 2, and then add another patient each day. And you'll be amazed if you just start gradually incorporating it, but you've got to be persistent about it. The morning huddle is a great place to start that persistence. Be persistent about it, and it's going to come second nature. I mean, literally this morning we had a fight over the scanner, because I have one that's here. We got 4 scanners in the office. I got one that's here on beta test that I'm supposed to be using restoratively. And they're using it in hygiene. And I'm like, hey, I need this scanner. Well, I need it. I'm like, well, no, I kind of need it for the testing purposes. You take one of the other scanners. Okay. But it's like your scanners are moving all around the office the more you get.
Yeah. And it's, if you're just starting out with one scanner, you really got to be strategic.
Yeah,
but
very strategic.
What we did is we did a lunch and learn with the staff, and we practiced on each other first. And I even had them practice on themselves, when they had time. If a hygienist or assistant, if we didn't have a patient, I just had them scan on me, or they even did it just on themselves, or even on a model. And the more you do it, the quicker you get. But you're right. If you try to crowbar this in and have every patient scan, you're going to get a scaler thrown at your head. And
it's pushback. Never good. Never good. So,
all right. So what advice, and you've given tons of nuggets here already, but what advice would you give for the young dentists out there?
I say this, and I'm going to say, do as I say, not as I do. And the reason I say that is because I didn't do this. And if there's 2 things that I could have done over again, it's going to be finances and education. All right. So basically, let's talk about education first. We get out of dental school, and we are given something that we've never really had. and that's a paycheck. That's actually a pretty dang good paycheck. And a lot of us go down this rabbit hole of, oh, I'm going to get a new car. I'm going to get this. I'm going to get that. And I would say that with the amount of money that you are able to make when you get out of dental school, you need to earmark part of that. Part of it needs to go to education. I know we just finished educating ourselves, but you are nowhere near finished educating yourselves. Put money aside for quality education. And there's several places out there. There's Coyce, Pankey, Dawson, Spear, so many other places. Reinvest some of that money in your education, because if you got to stay in tune with the times, and you've got to constantly add or at least create opportunity within your practice. And it's there. It just may be a new way of doing things. It may be you go to Spear to learn how to do, a more comprehensive examination. That's okay, because you can't do half of the examination that you learn outside of dental school. I mean, when you get out of dental school, you can't do half the examination that you could after taking one of these educational courses. So reinvest in education. And then the second thing is start socking money away for retirement. So take a bucket to live off of and take two buckets, one for education and one for retirement. And under that retirement umbrella, if you're going to have children, make sure that your kids' college is covered. You can't start saving soon enough. And if you've got extra, then pat yourself on the back, because, I don't want to be doing this forever. And I feel that I could have been better at socking money away. I mean, I can't retire tomorrow. I don't anticipate retiring on tomorrow, but I know some dentists that are close to my age. They're like, I could retire tomorrow if I wanted to. And I know that that's a great feeling. So make sure that you're prepared financially for yourself, your family, your kids, and make sure that you invest in education, quality education outside of dental school. You learn a lot in dental school, but not nearly enough to get through your practice.
That's good stuff. Now, what I want to end up on is what you're up to, because now I can actually call you a dink and you wouldn't get offended. Tell me about dentistry in the know and the dinks out there.
Yeah. So we started during COVID, kind of a little passion project. COVID hit, and one of the guys that I speak with, Dr. Jeff Horowitz, calls me and he's like, man, all these lectures that we had lined up are gone. My practice is gone. It's going to come back, but it's gone. I have nothing to do. So we decided to start this weekly quote unquote variety show where we, kind of commiserate and where we share the news. Dr. Jennifer Bell joined us about a month into it. We were trying to figure out a name, call it Dentist in the Know. And so acronym for that would be DINKS. And so that it does not stand for double income, no kids, which that would be nice too, but it doesn't. And so every week we have a live show that converts to a podcast, to a YouTube episode. And it's branded on Facebook indefinitely. And we have an educator, influencer, manufacturer, somebody in dentistry that can hopefully provide some valuable information for somebody out there. So we focus on education, trends, politics, all dental related, and how it can, how we can be better served and how we can better serve our patients.
That's great. Now, how do we find out more?
So easiest way would be go to Facebook groups, Dentist in the Know, or you can follow us on Insta at Dentists in the Know, or look us up on YouTube. Our YouTube channel is probably the most prolific right now.
That's awesome. And I love the reference to the original Vacation movie. Yeah. One of my favorites.
So I actually just pulled that clip and I incorporated it into all of my lectures because I absolutely love that. And I think sometimes we're Clark Griswold and sometimes we're John Candy. It just depends on what the topic is. But there's a lot of times that, according to either us or our team, the park's closed. Moose out front should have told you. So, yeah.
Love it. All right, Dr. Chad Duplantis, thank you so much for joining us.
Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress-Free Dentist.